Hello everyone, myself Dr. Sarfraz Robert. I'm the IELTS and OET expert. Today I came up with another valuable video regarding the OET speaking sub-test. The OET speaking sub-test contains two consultation role plays. You will be given two role plays to read and speak about. You will be given 3 minutes to read each role play, and then you're going to speak about 5 minutes to fulfill the tasks which you have been given. The OET speaking has setting and the background information and the task. So this test is divided into 3 sets. Now we are going to talk about the 2 criteria of the OET speaking subtest. There are 2 criteria where examiner is going to analyze your speaking. The first one is called linguistic criteria. There are 4 linguistic criteria which I have discussed in the previous video. And then the second criteria is called the clinical communication criteria, which are divided into 5 things. Now, today's task is clinical communication criteria. There are 5 clinical communication criteria, which is 3C. C for the clinical, C for the communication, and C for criteria. There are 5 communication criteria. Now, the first one is relationship building. Second one is understanding and incorporating the patient perspective. Third, providing structure. 4, information gathering, and 5, information giving. Now, in this video, I'm going to talk about the first criteria of clinical communication criteria, which is the relationship building. This is really important for every OET candidate to build a good relationship with the patient. How? What is the meaning of relationship building? How well you develop your rapport. This is rapport. This is not rapport because the T is silent. So we're going to pronounce rapport. Now, the meaning of rapport is that a close and comfortable relationship with your patient or their relative. Means that how close and comfortable you are communicating with your patient or his or her relative. Now, we need to develop the skills of having a good rapport or a good, close and comfortable relationship with patient. Remember, whatever I am teaching, I'm teaching you the criteria to achieve your high bands, high scores in the OET speaking. Therefore, it is highly recommended for everyone to pay attention of every word you are learning in this video. Now, the first thing which is coming to have a good relationship building is initiating the interaction appropriately. What it means by that? It means that how you're going to start your communication, what words you're going to say, because the first impression is really very important. Now, first words, what you're going to say, these words can decrease the anxiety of the patient. However, if you're not going to use an appropriate, if you're not going to use appropriate words, then you may increase the anxiety of the patient. Therefore, one must know in which condition, what words to start with. Now, for example, if patient is waiting for a long time, one must come and need to apologize first before introducing himself or herself. So it is very essential for every OET candidate to pay attention what is the circumstances and how we are going to start our conversation. Now, there are a few things which we need to remember in our speaking OET subtest. The first thing is this, that the setting of your conversation. When you're going to read or prepare your OET task, you will be given a setting. So, for example, I have written here ER, which is the emergency. If you are sitting in the emergency situation, then you're going to start your conversation according to that. On the other hand, when you are going to focus on the background of the situation, it will also help you how you're going to start. For example, if you know the patient, if you are the GP of that patient, you're not going to introduce yourself, you're not going to ask his or her name. Therefore, you are going to start directly approaching the task. That is the reason to know the background of the situation. Thirdly, any emotional factors. Feeling of the patient is really important. So one must really know by reading the scenario, reading the task, how the patient is feeling. This will help you how you're going to start your conversation. The fourth one is this, that the nature of conversation. What is mean by the nature of conversation? Why are you having this conversation? You need to know what is the purpose of your conversation between you and the patient. So this is the first thing. Now let us jump to the second thing. To build your relationship, building a rapport. The second thing is this, that you're going to demonstrate an attractive and respectful attitude. Your attitude must show respect to the patient. Now, focus on your patient while they are speaking. Majority of the candidates, they do not focus on their patients answering, because let me tell you, majority of the candidates, they, while patient is talking to them, they are not listening attentively, and they are thinking in their brain what I'm going to say next, what sentences I'm going to make. They are imagining their words in their brain. They are not fully attentive to the patient, what the patient is speaking. So that means that you are not demonstrating an attractive and respectful attitude. If you will not pay attention, you will fall in this criteria. You must hear what they are saying. In this way, you are respecting the patient. In this way, you truly are understanding the patient feelings and their opinion. I'm going to teach everything in detail in the upcoming videos, how we are going to approach each criteria. But for today, we are going to learn the third thing, how we are going to build a good relationship. Now, adopting a non-judgmental approach is the third thing which one must know in order to achieve the high score in the OET speaking sub-test. What is mean by that? Many people have their own choices. We should not be judgmental to any patient. For example, many of the patients, they prefer their particular treatment path in a different way. Many will like antibiotics. Some will like non-surgical options or non-surgical treatments. Most of the patients, they might like medical or non-surgical options to choose rather than opt for the surgical procedures. Therefore, we should not be judgmental, and we are not going to emphasize, we're not going to enforce any of the patient. Therefore, we need to have non-judgmental approach. Another way, some patients, they are reluctant to change their lifestyle or their current routines. It is really challenging for them to change their routines. We are not going to be judgmental with them. The third thing is, many people have poor diet or poor exercise. We're not going to accuse them by having poor diet or poor exercise. So we have to have the non-judgmental approach. Fourthly, we are not going to be judgmental on using of the alcohol or tobacco, because this is something really personal. So we must not intervene in any of the personal issues by having the non-judgmental approach. Now, the fourth thing which you need to do by relationship building, and that is extremely important, and that is showing empathy. What is the meaning of showing empathy? The meaning of showing empathy is ability to understand and share the feelings of another person. For example, if someone is telling you that I don't know, I'm afraid, I don't know how to use the insulin syringe, I'm really afraid, this might hurt me, or maybe I might have more complication by using the insulin syringe or insulin. So you're not going to say that no, you have to do it, no, you have to do it. Rather, you must show empathy, and you should say, I truly understand what you mean. I know how you feel. If I was you, I was thinking the same thing. Or you must appreciate them first. You must reassure. What is the meaning of reassurance? The meaning of reassurance, to take the fear, to take the doubt out of their mind, and to give them that relationship building in their communication, so that we will not neglect their opinions. However, we will respect their opinion. At the same time, we will prove them that what is the best option for them as well. So this is all about the relationship building. In the upcoming videos, I'm going to talk about the second, third, and fourth, fifth criteria of triple C, which is clinical communication criteria. If anyone is interested to learn OET from me, please do communicate with me. I encourage all the doctors, nurses, pharmacists, and physiotherapists to join my online sessions in order to get B or B plus in their OET test. Thank you so much.